Okay, it's 12:30.
So there will be one eventually.
So do you want to do it, Laura, or shall?
Oh, you can.
Okay, well, welcome to the first meeting of the Health and Wellbeing Board for this municipal year. We need to elect a chair, so may I have nominations, please?
Martin Towler.
Okay, is that seconded? Yes, all right. Are there any other nominations? Nope, so I suppose we are all happy with that. I'll hand over to Councillor Towler.
Thank you very much. Next one is to appoint a vice chair. Can we nominate Maria?
Would like to?
Thank you.
No second.
Thank you. Vice chair then.
Thank you.
Now the interesting one. Questions from members of the board, members of the council and members of the public. James, you want to talk?
Thank you, Chair. As discussed, I have a question. So just to introduce myself, my name is Councillor James Valentine. I'm the councillor for Kempston West. And Kempston West is one of the four borough wards which make up Kempston Town, which is, as you know, the twin town of Bedford. So Kempston's been pursuing improved primary care facilities for well over a decade. As a town of around 22,000 residents, with an ageing population and significant pockets of deprivation, the need is both long-standing and well-evidenced. I'm very pleased to see Kempston included within the proposed pipeline of 56 neighbourhood health centres across the central and east area. However, Kempston is not starting from scratch. Local councillors, Bedford Borough Council and the former BLMK ICB have already undertaken a substantial amount of preparatory work. A strategic outline case identified the former police station site on Housley Road as the preferred location, and Bedford Borough Council subsequently agreed to acquire the site, and the ICB then commissioned Turner and Townsend to produce a fully costed outline business case covering the strategic, clinical, economic, commercial, financial and management case for a new primary care centre. Councillors also supported a modular build approach specifically to improve affordability and deliverability. King Street surgery is a training practice, but its ability to train the next generation of GPs has long been constrained by lack of space. A new facility would therefore benefit not only Kempston residents, but primary care provision across a much wider area. Given that some schemes on the proposed neighbourhood health centre pipeline are reportedly still at the early concept stage, can you confirm that the ICB is fully aware of the extensive preparatory work already completed in Kempston, including the availability of a developed business case and a potentially deliverable site, and will you commit to ensuring that Kempston's proposal is given appropriate priority as funding opportunities emerge? Thank you.
Thank you very much for the question, Councillor. Yes, we are aware of all the work that's been done on this business case, and I think the best case scenario is about a £17 million investment. And at the moment, in terms of what's available to the ICB, that's well in excess of our access to capital for these kind of schemes. That we will support and continue to work with the council on looking at all funding opportunities for this scheme.
Thank you very much. I mean, if I could come back, the funding, there's another sum mentioned, I think of £150 million across the wider area. Perhaps you could just clarify that.
Yeah, so the neighbourhood health centre pipeline, which I think you were talking about, where we have this on our list of schemes for Central East, the national funding, so across the country, is 150 million capital over 3 years, so 50 million each year, and that's nationally. So our expectation, if that was given out on a kind of fair shares basis, would be that we would get maybe 2-3 million for Central East, so nowhere near enough to fund something like this. So we need to work with partners and look at all funding opportunities. The government is proposing things like public-private financing for new builds and things. So we will need to look into that and work with developers, work with the council at what options we have. But that's unlikely to really make any material difference to a scheme like Kempston.
Could I just make a very brief
Comment, yes.
brief final comment? I mean, we've been discussing this over the years, for the past 10 years. I've always been open to the idea of having some sort of private investment. And the question seems to be, when we've talked with the ICB as to whether the returns would be sufficient for the private sector, I can't intuitively see why and that shouldn't be possible. So I'm really glad anyway that the government's looking at that sort of possibility. And I mean, all I can say is, on behalf of Kempston councillors, the goalposts have been moved a bit. So if you look at the specification, we seem to have moved away purely from a clinical basis to looking more at a community centre or whatever. We would have loads of ideas about how we could tailor the proposal to make it fit. So what I would say to you is, please don't hesitate to come back to us as Kempston councillors if you think we can help in any way to adapt the proposal to make it fit the current government specification.
Thank you. So, I mean, what's gone in for the neighbourhood health centres is an initial list of suggestions, and we're waiting for feedback on that. So happy to come back to this meeting once we get some feedback on that as well and keep you informed of that.
Thank you.
Just to note, the MP has been lobbied quite hard, and I think we need to continue lobbying the MP to see if he can get a single grant for that project. Would be good. So did you have a supplementary or just
No, I'm just here shotgun. Thank you.
Okay. Are we safe?
No.
Thank you very much. With no more questions, we'll move on to apologies, Alison.
Okay, I have received apologies from Emma Frida, Kate Howard, and Lorraine Sanuza. Are there any other apologies that anyone is aware of?
Yes, Prashant.
Okay, yeah.
The next thing on the list is the minutes. Do we approve the minutes? Silence says yes.
Yep.
So yes, we approve the minutes. Item 6, disclosure of local and discernible pecuniary interest. Anybody? Quiet again. So we'll write that one off. Okay. Then the real meat. Health and Wellbeing Board constitutional terms of reference. Ian will present.
Thank you. So we have not proposed any changes to terms of reference, but you all have these papers and a chance to look at them. If there are any changes that would like to be proposed, we can discuss those now, but they would need to be taken through our General Purposes Committee for agreement. So the papers for you, and you're asked to consider, and if you're happy with the terms, to approve them for the next municipal year.
Anybody any ideas? Any thoughts? Okay, for today I will take it as read then and thank you, Ian. No change. Item 8, Bedford Borough Best Start Strategy. Wendy will present the new Best Start Strategy.
Thank you, Chair. Good afternoon, everybody. Within your pack, you have the report and the Best Start Strategy 2026 to 2029. And I'm pleased to be able to introduce it to this board today. I think it's really important to note that this strategy has been developed with partners across health, education and the voluntary sector, and most importantly with families themselves. and it represents a genuine whole system commitment. It's not just a council document, it is a whole system document, and it's really important that we, that is acknowledged. And the commitment of everybody to actually creating and developing this strategy, including colleagues in this room, should be noted. The strategy has 6 interconnected priorities, and I think it's really important to know that this is now the overarching primary strategy for early years in Bedford Borough. It supersedes the early years strategy. It is the one strategy which brings everything together for the system to ensure that we are giving Bedford Borough's youngest children the best start in life. And the 6 priorities are early identification and prevention and timely support, supporting parental mental health and emotional well-being, promoting equity and reducing inequality, high quality, inclusive and accessible early years provision, empowering parents as their child's first and most enduring educator, and strengthening collaboration across services. There are some pieces within this strategy which are new. Those of us that know early years well, and I've been here quite a while now, leading on early years. We know that a consistent approach is about securing, that ongoing improvement. We do have a target now, which is set to, for us by the department, of reaching 75% of all children having what we call a good level of development by the end of reception. That's quite a step for us in Bedford Borough from where we are now, which is in the high 60s, 68% that is, of children securing a good level of development. So we have a way to go. However, what I do know is the consistent approach that we have to securing quality and ensuring that we are implementing the highest quality for children from the youngest age is supporting us on that trajectory. And indeed, we are now in line with national, which is a real success for us in Bedford Borough. But we do want to make a step change and secure the pace to make sure that we are working well towards meeting that target. So within the strategy, we have some genuinely new areas of priority. Parental mental health is a standalone priority, and this is really for the first time naming parental mental health and emotional well-being as its own strategic priority. We know that a parent's well-being is inseparable from their child, so we're committed to accessible perinatal mental health services, upskilling our workforce to spot early indicators and embedding a digital offer so parents can get support when they need it, including, most importantly, low level and early stage needs that can otherwise go unmet. And I'd like to commend my colleagues across health services for their commitment to that and supporting that priority. Developing the Best Start Academy of Inclusive Skills and Knowledge, a new dedicated professional development offer for our early years workforce. The quality of our practitioners is the single greatest lever we have for improving children's outcomes. And this formalises and strengthens that investment. And it's, I think, a real testament that the majority of our early years settings in Bedford are judged by our regulator to be of high quality. We need to maintain that into the future, and this developing this Academy of Skills will really support that. Making sure that we have a Best Start data dashboard. We have a lot of data in the early years sector. My colleagues in health will know well how much data we have. It's about how we utilise that data and how we analyse it to make sense of where we need to focus our priorities. So developing a Best Start data dashboard is key for us. Structured co-production with families. The family hub parent carer panels are going to be embedded across the early years sector as a standing mechanism for family voice. And this is a genuine shift towards designing services with families, not just for them. And obviously I've talked to you about the statutory target of 75%. So in summary, those are the priority areas, those are the key points, and I would just want to commend that to this board, and I'll take any questions that you may have.
Any questions?
Sorry. Yes.
Okay.
Not a question, really just a comment. Because I think there's probably a link that we could make with adult services on the transition and early health prevention side, and particular links probably with our OT team that also provide services for children. I think that would be a really good link if we can speak about it with Prashant Agrawal, who has responsibility for that area.
I should be very happy to
Yes.
speak for
I know you
about
speak
that.
to him often.
I speak to him often, and I will enjoy having that conversation.
Great.
Kate.
I
So,
think it'd be a
yes.
really good link.
Yeah, definitely. Let's do that.
Thank you.
Thank you. Yeah, well,
Thank you, Wendy. We know that there are groups of children who find it much harder to achieve a good level of development by the end of reception. I wondered if you could say a little bit about sort of some areas of specific focus we're going to need to have in order to make sure that we achieve a step change for all of our children, not just including those who are eligible for preschool meals, for example.
Yes, indeed. So obviously there are a number of strategies that the department has in place for ensuring that those children who most need access to high quality early years provision can access it. We already do well with for example, our 2-year-old offer, and ensuring those children have access to a place. So currently in the kind of mid-70s, we need to make sure that we are doing that and keeping on with that work. As part of the family hubs work, we're going to be recruiting a post which is going to be going across our early years team here in the council, but also into health, into our 0 to 19 team, so that we can spot early those families who are not turning up to appointments, those that are not accessing services. So that joint appointment is going to, I think, help us again to reach some of those families that need support early. We're hard to reach, they're not hard to reach. We collectively know who they are. We know we have the birth data, it's all there in front of us. What are we doing about it? Well, we need to have better communication between our services to make sure that we're reaching those families. And so this post will allow us to do that and overcome perhaps some of the barriers that have been in place. The other thing that we're doing also is about making sure that our link workers are with our family hubs are going out and we're into those communities and are reaching again, but finding those families because they are there. We know that they are there. If we can find them, it's about getting alongside them and making support not something which should be feared and overcome. Actually, it's something which everybody needs. So again, language barrier, we know that is in some of our areas. So making sure that, again, our workforce is diverse and can connect with communities where they are with their voice and support them to have their voice as well in service design. Hope that helps.
Thank you.
Yeah.
Thank you.
I was just, it's more of a comment. I was just going to say that I really welcome this. It's such an important area. And there are so many different parts of our system that are involved, and it's a really great example of us working together, not just across the council, but with partners and putting together that plan. So it just feels like a really positive thing. So thank you and all the colleagues that have worked.
Thank you, Vicky, and again to Ian and Amy who have we've walked together to get this in place. And I think it's been, as you say, an important joint piece of work. So yeah, thank you.
I agree with what Vicky has just said, but could you just tell us a bit more about the Best Start Academy? That sounds quite an interesting and exciting opportunity. So I think there's some really good opportunities to link it back to the civic agreement that we've done with the University of Bedfordshire. And I think could you tell us a bit more about how the voluntary and community sector are going to be engaged in that?
Absolutely. So at the moment, so we have a strategy here, Laura. We have an action plan which we're working hard, which will be underpinning this strategy and how we deliver. And we hope to have that in place by the end of this term. So able to come back to the board if you would wish to present the action plan that will make that happen. So we've already got a strong partnership with the University of Bedfordshire in the early years sector. They're on our early years reference group, and we've got a strong partnership which is about making sure that people who are coming through into the sector are getting the qualifications and support that they need. So it's about how do we build on that, but also how do we make different kinds of offers available to the workforce? And we've also got a partnership with Central Bedfordshire and their workforce team over there for providing, again, other qualifications. So it's about bringing that together, but it's also about supporting the community and us upskilling the community, providing information, access to training, access to information and advice and guidance when they want it. We know, for example, our Parent Carer Forum are very strong at providing parents with training around, the area of special educational needs, for example. So how can we build on that work as well and bring that into the early years, into the academy? So there's a number of strands that actually we just want to pull in over with the overarching heading of the academy, which kind of provides some coherence to something which perhaps isn't. There's a lot going on in the space. It just provides a coordinated coherence to what we're doing.
And is it a sector where we have challenges on recruitment and retention?
Well, nationally, there is a challenge on recruitment and retention of, for example, childminders in the sector. We know in the Eastern region, there's been a significant drop in the number of childminders that are coming in to work in the sector. It's something that we don't experience quite as significantly as some of our other authorities. We've managed to maintain our childminding community. I think our early years private voluntary and independent sector is something which we're always keeping an eye on in terms of numbers of settings. Those are the closing. At the moment, we're not experiencing a significant sufficiency issue, but it is something which we are very mindful of, especially as the government keep bringing in, new expectations. It's something which we have to be mindful of. But with the development of school-based nurseries, for example, we've been able to overcome some of those challenges.
Thanks, Wendy. It's really great strategy, and I was just going to connect it with our kind of neighbourhood work. We're starting with the older population, people with frailty, but our next cohort would be children, young people, and families. So it's really good to have this and then link that into that work and the work you're doing here to try and bring partners together to work in that integrated way. It'd be great to share learning on that over the next few months, just so we make sure we're sort of cross-fertilising both projects.
Absolutely. Maria, Laura has already talked to me about, we've had conversations about neighbourhood working, and I think for us in children's, as we are transforming services with Best Start, the Families First, all of those reforms, it's really important that we are connecting together to make sure that our approaches are aligning and they are coherent for our communities in Bedford Borough. So I welcome your invitation and look forward to working with you on that.
Okay. Anyone else? No, James.
Yeah, it's just you mentioned those two strategies, and also this new SEND reforms. They're all sort of area based, place based, but it just seems like they might not actually align where they are at the moment. What are we able to do to make sure that we've not got sort of overlaps and crossovers and gaps in those different strategies and what they're actually providing?
Okay, I think there are. So Best Start, SEND reforms, Families First reforms, they all link in, they all overlap. You can layer them all together and they all interlink. I think, it's all about our design. So the work that Maria is doing with the neighbourhood health is really important that we're overlaying that as well. So when we're talking about what the design is for our neighbourhoods in Bedford Borough, that's up to us. That's up to us to make that coherent and make that work, to make sure that we haven't got gaps, but also to make sure that we've got sustainable a sustainable design of service which is coherent for our communities. That's our job. We need to do that. So I really welcome Maria's invitation, really, because it means that we're going to stand a really good chance of getting it right, because here I am now, I've got the connection, and we stand a really good chance of actually been able to put together a really good design. So as you know, Jane, we're in the process of the design of Families First. I'm working on that with lots of people now with Maria. So that's a good thing. We've got some way to go on that. But best start again. The early years sector will be. It won't be difficult for us to actually align that to the neighbourhoods. It will work. I have confidence around that. So yeah, I think it's a work in progress. All right.
Thank you. Anybody else? I think we've had good engagement on this. Thank you very much for that. We're asked to note it, I think. We've been asked to consider the best start strategy and note. So it's been noted. Thank you very much.
Thank you.
Now, Vicky, you'll be giving us a public health and report.
I will. I've just joined the call, so I don't need to.
Yes.
Am I there?
Well, you're on my screen,
Yeah.
but I think if somebody goes up to there and pins you, it might be easier. So I've done it from my end. It doesn't seem to be showing up on the screen properly.
In on the export.
Just gonna share.
Make an attendee.
Slides. Oh, do you need to make me able to share, Alison?
But you should be able to share.
I can't share.
Mr. IT's up there, so it's all right.
No pressure. Ian.
As you're a presenter, Vicky, can you?
Oh, now I can share, yeah.
But you're not coming up.
Oh, there we go.
Okay.
Right. I don't know if you close the chat, I don't know if it gets a bit bigger, sorry. So just I've got so many demands. Thank you. So people who have attended health and wellbeing boards before know that one of the things directors of public health are supposed to do is, or expected to do, statutorily required to do, is produce an annual report on the health of their population. It's an independent report. Over the past few years, we've tended to take a deep dive approach. So we've looked at some specific topics in a lot of detail. Last year, we talked about population change. We looked at excess weight before, homelessness, that kind of thing. This year, I've chosen to take the opportunity to step back and remind us what the big things are. So what the significant areas, the most significant areas to focus on if we want to improve the health of our population overall. So it's a more kind of broad perspective this time. And I guess just before we start, a bit of context to remind us that there is still a lot of scope to improve health in Bedford, and particularly when we look at it from an inequalities perspective. So if we look at the difference between our most and our least deprived areas, there's a 16-year gap in life expectancy for men there still, and nearly a 15-year gap in health, in the number of years people will live in good health for men. And in terms of the health experience that people perceive for themselves, if we compare men who live in Harper Ward, they're twice more likely to see their health as being not good than men who live in Oakley Ward. So that's people's lived experience of their own health status. So there's lots of scope still to improve health. And we do, within public health, we do a lot of work through the Joint Strategic Needs Assessment on all the data that there is so that we can understand where the health need is, what the issues are. And we tend to get into quite a lot of detail there. And I think sometimes it can be hard to sort of, through all of that detail, identify what the big things are. And so what we've tried to do here is just that stepping back so that we can articulate the key things that are driving poor health in our area. So in a way, the annual report this year is almost like a sort of summary of the JSNA. So just trying to help people stand back and see what the main things to focus on are. The way that we've done this, so our analysts have developed a tool that pulls together the headline data across loads and loads of different things, allowing them to compare them and identify the areas where we have the potential to have the biggest impact. And looking at that across all age groups and then across the different parts of the life course as well. You've got the full report in your pack. I'm going to put up some slides that are a slightly simplified version,
But for each area, we've identified why it's important, and then we've given examples of the sorts of things we could do if we wanted to try to make a difference on them. I'm not going to go through all of those today, we don't have time, but they're there. And in a way, they're just there to give you a sense of how we can impact things, because actually a lot of the areas we've identified are complex problems. There's no single thing that we can do to fix them, and there's the potential for different organisations and different partners to tackle them in their own different ways. So what makes something a high impact area? So we've got kind of five dimensions that have fed into that. So something might be important because it affects a lot of people in our borough. It might be important because it's got a really strong link with health outcomes. It might be important because it's a significant driver of health inequalities. It might be important because actually we're seeing things are getting worse for us in the borough. Or it might be important because we know that we are doing worse than other areas that are like us. So there's lots of different ways of looking at the kind of problem of where should we be focusing. So when we look across kind of the breadth of the JSNA, through that lens, there are 4 areas that we picked out as our kind of highest impact areas across all ages. So the first one of those is how we can make it easier for people to be active and maintain a healthy weight, how we can work towards a smoke-free environment, promoting good mental health, and then supporting those who care for others. So those are our 4 all-age high impact areas. Just running through those one by one. So the top one there is making it easy to be active and maintain a healthy weight. So this is one of those ones where an awful lot of people are affected. So by year 6, 1 in 3 of our children will be affected by excess weight, and 2 out of 3 adults are affected. We know that excess weight is among the top risk factors for years lost to poor health. And we know that that's through conditions like heart disease, stroke, diabetes, etc. There's a really strong inequalities dimension with weight. So children living in more deprived areas are twice as likely to be living with excessive weight or obesity than those from less deprived areas. And then if we look at the trend over time, we have seen levels of excess weight continue to rise. Now, I think there is a note there that we are at an interesting point with the new obesity medications that are available, and it will be interesting to see how that does or doesn't turn the tide. But there is still a lot we can do to stop our children gaining excess weight, leaving them in a position where those medications might be necessary for them in the future. Just looking at the what can we do box on this one, I'm not going to do this for all of them, but just to highlight that on a complex problem like obesity, there are lots of different ways of tackling it, and we need to do all of those things. So it's not just about increasing the number of people who are using services to support them to lose weight. It's also about how we can design and build places that are healthier to live in, that promote physical activity, how we can use the planning system, for example, to limit unhealthy exposures like hot food takeaways, and how we collectively can make it easier for people to access fresh and healthy food at low cost close to their homes. So that was the first one. Why am I not moving? So then the second one is working towards a smoke-free environment. So this is another one where lots and lots of people are affected. So 12% of our population still smoke. That's about 18,000 people in the borough. And if we then think about the harms caused by secondhand smoke, so there's an extra 57,600 approximately people who are exposed to secondhand smoke. As we all know, smoking is a really significant cause of poor health. So we know about the links with cancers, COPD, etc. But we also should remember that children and young people who are exposed to smoke have a greater risk of asthma, and babies are at a higher risk of sudden infant death syndrome. This is another area where we've got significant inequalities. So smoking prevalence is still a lot higher in our more deprived areas. And we also see more smoking related hospital admissions in our more deprived areas. And we're not quite making the impact we would like to make on prevalence. So prevalence has stuck at about 10% for a while. We've actually seen a little bit of an increase in the most recent data. So we need to not be complacent around smoking. Our third area is around promoting good health. And again, there's a scale thing here. So 1 in 4 adults in the UK experience a mental health problem in any given year. We've got around 22,000 adults in the borough who are registered with GPs and who have a record of depression. So, it's something that affects an awful lot of us. And it's the #1 cause of years lost to poor health for children and the #2 cause for adults at working age. And we still see very significant excess mortality for people under 75 who have severe mental illness. Another area where there's a strong link with deprivation, and broadly we see declining trends in mental health across a range of indicators. So the fourth one here is around supporting those who care for others, and I think it's quite sobering to remember that nearly 2/3 of us will become an informal carer at some point in our lives. So that in Bedford Borough, that's around 25,000 people who are caring for others. Most of them are working age, 2/3 of them are women, and we know that their health is less good than others. So 70% of carers known to GPs have a long-term condition themselves. They are nearly twice as likely to suffer from chronic pain, musculoskeletal disorders, more than twice as likely to be lonely or socially isolated, and half as likely to have a good quality of life. There are some inequalities, particularly around whether people are identified as carers and whether they're receiving any support. And we also know the numbers of carers are increasing across all age groups. So those are our 4 across the whole of the life course. So looking at children and young people specifically, our 3 high impact areas are early and continued access to maternity care, protecting children and young people from infectious disease, and reducing the impact of income deprivation. So in terms of maternity care, so this is relevant to any time a baby is born. So it's around 2,000 births in the borough every year. And at the moment, around 1/3 of mothers did not have an appointment booked within 10 weeks of pregnancy, as set out in the recommendations by NICE. So we know that early access to healthcare is very important in terms of preventing preterm birth and other poor outcomes. There are some really significant inequalities in this area. So among women from Black ethnic groups, less than half benefit from early access to maternity care. And we also know from national data that they are nearly 3 times more likely to die during pregnancy and birth. And stillbirths are twice as common, and neonatal deaths 1.5 times more common. So we've also seen a significantly worsening trend in Bedford. So in terms of people booking early, so the proportion booking within 10 weeks of pregnancy has fallen from 80% in 2019-20 to 67% in 2023-24. So there's definitely some work to do there to improve. And we know we don't have completely great outcomes, so the proportion of babies born at a low rate in Bedford is higher than nationally and higher than areas with a similar level of deprivation. That was #1. And then #2, protecting children and young people from infectious diseases. So again, this is relevant to all of our children and young people. And the WHO has listed falling vaccination uptake as one of the biggest threats to global health. We know that there is a strong relationship, particularly around ethnicity. So fewer children from ethnic minority groups receive vaccinations. And we are seeing declining trends again in the borough. I think what I would emphasise around this one is that the evidence tells us that the most important thing we can do is make vaccines as accessible as possible. So we need to think about how we make them available at different locations locally, making information about them easily available and accessible, and ensuring that professionals across, from different organisations take every opportunity to talk to families about vaccination. Our third one here is around reducing the impact of income deprivation. So around 1 in 6 children in the borough live in poverty, and if we include the cost of housing in that, so that number rises to 1 in 4. So affects lots of our children. And again, there is a really clear link between income deprivation and health. So not just around things like obesity that we talked about, but also looking through early years development, academic attainment, oral health and asthma, And we can see differences in some of the outcomes, like proportion of children who have visibly evident dental decay or the rates of hospital admissions. We can see those inequalities very clearly. And when we look at the data over time, more of our children are living in poverty now than they were years ago. So moving on to our working age people. So there are three areas here: are reducing the impact of poor health as a barrier to work, identifying people at risk from long-term conditions and being more preventative in our approach, and then helping people change behaviours that impact on their health. Reducing the impact of poor health as a barrier to work. So we know that work is incredibly important, and we also know that we need a healthy population in order to drive good economy. So in the borough, there are nearly 20,000 people who are economically active and not looking for work. And in about a quarter of those cases, that is due to long-term poor health. We've got about 5,000 people who are unemployed and claiming benefits. So if we look at our economically inactive males, they're 3 times more likely to perceive themselves as in not good health. And when we look at people with long-term health conditions, there's a 17 percentage point gap in terms of their likelihood of being in work. So people who are not in work, their health is poorer, and people whose health is poorer are not as likely to be at work. It works both ways around. And we can see the inequalities in terms of the lower level jobs and the links to poorer health. Again, this is another area where we're not quite where we would like to be compared to other areas. So we have higher proportions of people who are unemployed and claiming benefits than average for England. And that gap in levels of employment is bigger in Bedford for people with who are using secondary mental health services than it is nationally. Identifying those at risk of long-term health conditions. So at least one in 5 working age people are affected by a physical or mental health condition. And some of the most common conditions are conditions that impact a lot on years lost to poor health. So mental health conditions, musculoskeletal cancers, cardiovascular disease. There's a really strong relationship between these and deprivation, and we can see that there are many more preventable deaths in our more deprived areas. There are some negative trends. So the proportions of people with diabetes and high blood pressure, for example, are increasing. And again, some of our performance isn't as good as other areas. So we have higher prevalence of diabetes in Bedford Borough than England's. And when we look at people with high blood pressure, we have a lower proportion of people whose condition is being managed well than the England's average. Helping people change their behaviours. So I've already said that there are around 18,000 adult smokers in the borough. You've probably got over 30,000 people who are drinking alcohol at levels that increases their risk of ill health, around 2,200 people who are using opiates or crack cocaine. And there are very strong links between these behavioural risk factors and health outcomes. And as you would expect, there are lots of inequalities there. We're seeing some negative trends. So, for example, in the rates of hospital admission for alcohol-specific conditions, and in the borough, we have a higher prevalence of opiate and crack cocaine use than England as a whole, although we also see that that is matched by higher use of specialist drug treatment services, which is a good thing to see. And then just finally moving on to older people. So our 3 high impact areas are supporting people with dementia to live better for longer, supporting independent living by identifying and preventing age-related conditions, and then reducing the impact of income deprivation on health. So in terms of dementia, we have there are likely to be almost 2,100 people in the borough living with dementia, but we know that probably around 500 of those people are not accessing the support and care that is available for them. Dementia is one of the top 5 causes of years lost to poor health for people aged 65 and over, and we know it also links with emergency hospitals. And as our older population is growing, we are inevitably seeing more people in the population with the dementia diagnosis. And I guess one of the key points to make about dementia is that actually nearly half of dementia cases are preventable. And if we look back at the working age behavioural health related behaviours and so forth, if we can prevent those long-term conditions in working age, then that will also reduce people's likelihood of developing dementia in older age. So then our second for older people is around supporting independent living, and just that reminder that those age-related conditions affect lots of people. Falls are the largest cause of emergency hospital admissions for older people, and some of those age-related conditions are among the highest drivers of poor health for older people. So musculoskeletal disease disorders, including osteoporosis, injuries, and sensory organ diseases. So we see some inequalities. Actually, the white British population is more prone to hip fractures, but we see more early sight loss among ethnic minority communities. Some of our trends are worsening. The prevalence of osteoporosis increased from 0.9% to 1.2% over 5 years. That might not sound like a very big increase, but the numbers that will be that will reflect are significant. And we seem to see a higher prevalence of osteoporosis in Bedford Borough than average for England. Then finally, reducing the impact of income deprivation. So again, this affects lots of people. We have probably nearly 5,000 people in the borough aged 65 and over who are living in poverty, and probably nearly 1,000 people who are living in accommodation that might not be optimal. So it might be overcrowded or have no central heating. Inevitably, we've got strong relationships between deprivation and the prevalence of conditions like common mental health disorders. And the proportion of older people, if you look at the trend over time, we're seeing more older people living in deprivation than we were before. So those are our key areas. I've put quite a lot to get through there, but I think what I'm hoping is helpful is to just articulate what those big key points are so that people can understand the direction we all want to be moving in and see whether the things they're doing contribute to those areas. Just going back to the joint strategic needs assessments, that's something that we're doing all the time. We've got huge amounts of data available online that partners can use. As we're thinking about how we're developing that going forward, we want to really increase the focus on inequalities. And I guess one of the recommendations in the paper attached to this is that we all need to be, it's really helpful for us all to be making efforts to improve our recording of things like ethnicity, sexuality, socioeconomic status in our data so that we're able to do the analysis that helps us identify where we have the inequalities. And then some of the specific topic areas we'll be looking at going forward include these areas where we perhaps don't know as much as we'd like to. So physical activity, loneliness, vaping, homelessness, and frailty. So I will stop there. I'm very happy to take any questions or any. Thank you very much for listening.
Thank you. That was quite a lot, wasn't it? Well done for that. Is there any questions for anybody?
In terms of changing behaviours for working age, what about cannabis use? I haven't particularly mentioned that. Anecdotally, it seems to be pretty much endemic in Borough.
So I don't have any great answer for that or data kind of at my fingertips. I'm just I know what Charlotte's who knows loads about all that.
I mean, generally speaking, for young people, cannabis use is the most common substance, sort of in the under 18s if they are using substances. But in adults, there's others that we tend to see, you know, and certainly those that are coming into treatment tend to be much more entrenched, sort of alcohol, crack, opiate users, as opposed to sort of the cannabis use. So unfortunately, although we might sort of see it in our communities, I think sometimes those individuals aren't necessarily, they might be using multiple substances and then could be dealing with perhaps maybe a more serious substance within treatment. But if they are in treatment, they would be supported for all of those things. Yeah.
It could well be that cannabis can smell, so consequently it's far greater impact.
Vicky, it's really helpful to have this summary that picks up on all of the Bedford Borough related issues. We had a session with some of the key funding and support organisations for the voluntary and community sector yesterday, and one of the questions they asked actually was around how can they access data and information, and particularly I think the topic that we were talking about yesterday was that years of healthy life expectancy and that challenge of those years where people can live in poor health. So how can you and the team support some of the organisations with information to help them think about the services that they're delivering?
So, I mean, there's lots and lots available through the Joint Strategic Needs Assessment, and I think we can make sure people are pointed to the repository and the dashboards that are there. And I guess I hope perhaps that this report might be a kind of an accessible route into that, so to provide some areas they can kind of look at first and then can dive deeper into the data if they want to. But it is all there, so I guess we just need to think about, well, I don't know, I can pick up with you whether there's anything specific we can do to share links and so forth. That would be really helpful.
Yeah.
Can I just say a bit more on that? If that's
Yes,
okay?
please do.
So I think there's a couple of things. I think we have, I believe, in the past spoken to the Community and Voluntary Sector Network around about what's out there and how they can access data, and we're very happy to do that again. I think the other thing to note is that we do now have a local authority research practitioner in post in our team, and one of their objectives is to strengthen the way research and evidence is being used by our local voluntary community sector. So I think we can begin to build that relationship as well, so that we can hopefully provide not only, well, here's a website and here's, you know, where you can find stuff, but actually here's how you access it, and more tailored support as well to sort of hold people's hands, as it were, as well into finding the information that would help them to write funding bids or identify which strategic priorities they should be focused on.
Thanks, Ian, because that was the nature of the discussion. So that would be very helpful, I think.
I was just going to say that I think you talking to it as well really helps. So bringing it alive, but it's such a good summary, and you pulling out the big things is really helpful. And as you were going through it, I was thinking of the things in the ICB strategy that will help support this, and the conversation we had earlier about neighbourhood health plans. That really we need to do that kind of mapping across now, because MSK came up so many times. We've got a new provider coming in for MSK, so hopefully that can help them improve those outcomes, but just making sure we connect those things now so that they can understand the Bedford Borough needs more clearly. And obviously there's lots in here for the frailty work and the children and young people neighbourhood work. So we, I know, are working together to do those neighbourhood profiles as well, which will drill it down, because once you can see how many people are we talking about in what areas, it's just easier to start thinking about your response and how you can start to tackle that problem. It feels more doable. One of the things I picked out from when you were speaking is that I think that hopefully the neighbourhood approach should help, is that it's the barriers people feel to come forward and get support is really significant in a lot of these themes. So if we can create that neighbourhood feel where health professionals and others, VCSEs, are working together, the residents may find it easier to access support, and also teams working with individuals will think about the whole family, not just the individual and their individual issue that they're dealing with. And that's really at the heart of the neighbourhood work, isn't it? So helpful to see this, Vicky. Thank you. I think that will help us with the plans we need to do together.
Great.
Just a comment, really. Thank you. I think it's always really, really fascinating to see the wealth of information that comes out of this report. One of the areas, and we've talked about the interconnectivity between people generally and a number of these themes, but just drawing out, because Carers Week is coming up and we have particular organisations that are reaching out, and we are seeing already an increase in carers identifying and coming forward, particularly through the work with Mobilise and carers of all ages using the digital platform to gain access and support. So it's really just to draw out some of the issues that obviously is a priority area for those providers, but also I think going back to Laura's point about accessing the data and drawing some of the things as adult social care starts to work with the sector around the carer strategy, which will be linked to all of the things in here and partners as well. So I think it's some really rich information and really draws the lines between an older person with frailty who's a carer and who may have a number of these areas of living in areas of deprivation as well. So just thank you, but just linking those things together really draw your mind to where the focus can take us to next.
Nice comment. Any other questions?
Just a comment, Vicky. Thank you very much. I think, from the primary care point of view, I can see that in the areas that you've shown or recognized is, I think we all know that it's very well recognized areas, and having those numbers really helps. It just makes more impact. And we definitely welcome if there is anything that is out there from, which we are not aware of from a primary care point of view. And we welcome that, and we would like to support in any way we could. And as Maria was saying, I think this is really good to get this information because we can think about what we can do in the neighborhood, work, and it forms a really good foundation as to what we need to work for Bedford. So thank you for that.
That's great. Thank you. And I think there really are great opportunities through the neighbourhood health kind of approach and a new way of thinking about things to work together.
Thank you. If no more questions, we recommended to note this report. So thank you very much. We move on to item 10, the Better Care Fund.
Yes.
Yes.
And so I would be reporting this today rather than my colleague Bashan Agrawal. So we're asking the Health and Wellbeing Board to accept the report. It's the end of year report, so it summarises all 4 quarters, 25-26, before we move on to the plan for 2026-27. That will be coming to the next board because it's in with the Department of Health and Social Care at the moment for any last comments or anything that they need to send back to us for further clarification, which we're not really expecting, but it does take time to go through that process. So in terms of the end of year report, it gives an overview of performance. I must point out that some of the targets are set nationally and they can be quite challenging. I can draw your attention to 1.3 on the report. That gives a summary of all of the different challenges and also the areas of success. So the areas of success mostly are around new admissions into residential nursing home care, which have reduced by 30 in the previous and has come down year by year. It's one of the key indicators in the Better Care Fund, which is an indicator that more people are being helped to live at home for longer periods of time and maintain their independence. In terms of hospital discharge, 88% of patients or thereabouts were discharged on time, which is significantly above the 70% target. And the average delay of discharge is just 5.5 days rather than the 6-day target, which is set nationally. So those things we're improving on, and they do show good system flow out of hospital and good joint working operationally between health and social care. In that respect, we've got about 97% of people are discharged to their usual place of residence, which is also very comforting. If people have gone into hospital all of a sudden and then they come out, but they're not going back home or they're not going back to where they were before, that adds even more distress to them. So we've got 97% of people going back to their usual place of residence, which is really good. And just under 93% of people who receive reablement are at home 91 days after discharge, which shows that we're targeting reablement successfully to where people are going to get the optimum service. So they're all really positive. And although we haven't met every single target or exceeded it, there is steady improvement. And there's always a but or a however, and it's very interesting to hear the Director of Public Health's report in relation to falls, because they do remain a key issue for us. There were 487 admissions this year against a target of 428 in terms of people falling and being admitted to hospital as a result. So an average increase of 1 person a week.
over the space of a year. It's a smaller increase compared to last year, but it's still increasing. It hasn't come down or plateaued, it's still increasing. And we need to look at that. And also emergency admissions. The target was 1,800, but there were 2,200 emergency admissions to hospital. And that again is higher than last year. So although we're getting people out of hospital more successfully, what we're not doing is stopping them coming into hospital quite as well as we could. And so that will influence the targets for next year. So it is challenging, I said, with challenging level, and there are national targets for hospital admissions and also for falls. There is a focus on falls. One of the focus for better care fund is around falls, and so we need to make sure that what we're doing jointly is picking up. Is this in the right place? Is there something else we could be doing? Are the people who are falling and coming into hospital, is this the first time that they've fallen that we know about? Or are they people who have fallen and have admissions in the past? So a little bit more of a dig into those areas will be also helpful. And there's very strong engagement from people in preventative activities. So participation in leisure services has been reported as exceeding expectations, and some very positive user and patient and carer experience. Patient and carer experience remains stable. The focus has to be for the coming year on working obviously with neighbourhoods, and we're working very closely around that. And then strengthening prevention, and that ties into that other pieces of transformation work that are happening elsewhere certainly in the local authority around falls, looking at reducing emergency admissions and continuing to improve discharge and flow through the system. And I think that's everything that I need to say. So, thank you.
Okay, thank you. Anybody have any comments or questions in regard?
Just a quick question. Has the number of the population gone up? Maybe
Yes.
You mentioned a lot of good things which has improved, and things like emergency admissions have gone up. So has the population in Bedford gone up compared to? Has that made a difference? I don't know.
We think it has made a difference because the number of people living in Bedford has increased, and as time goes by, I'm very nervous saying this in front of my public health colleagues. As the population has gone up, the number of older people has also increased.
Yeah.
As well.
And the number of the very old people is an area of very rapid change at the moment, isn't it? So that's probably where you will see the most people. So it would be interesting. I did think the same would be interesting to disentangle whether the rate of falling, how the rate of falling is changing for that, age specific rate. Do we just have more people and they're falling the same amount as they always used to, or are we also seeing them fall more than they used to? So we can look at that.
And terminology, on the personal reflection, the terminology about falling also needs to be looked at. You're old when you go into hospital because you've broken an elbow, and they say you've had a fall. You think, I didn't think I looked that old. So, or everybody else falls over, but old people fall. Yeah. So we need to think about the terminology as well, because some people might be falling at home and they keep quiet about it because they don't want to be seen as, oh my goodness, they'll put me in a home next. You know the way people's minds work.
Yeah.
Just an offer of help, really. If you'd like to look in depth at those falling statistics, we've got access to record level pseudonymized patient data, so we can do a really deep dive into that. If that's helpful.
Yeah. So, Crash, I'm really pleased with that.
Noted it for
Anybody else? I need that. So, thank you very much. We'll note that report. Thank you. Item 11, the Integrated Care Board update. Maria, please.
Thanks, Martin. And the paper in your pack is a bit of a general update from the ICB as well as a focus on neighbourhoods. And Alex has probably got the more exciting paper for you guys on neighbourhood development in Bedford Borough, but I'll just pick out a few things from a kind of Central East ICB point of view that I think we've talked about before in these meetings in terms of progress that we're making. So as an ICB, we've been going through a restructure. I'm really pleased to introduce Georgie today, who I know many of you know, Georgie Brown. She's been appointed as the Deputy Director for Neighbourhoods for BLMK and is now in post. So the team that sits in the ICB in BLMK to help support neighbourhoods is coming together, and we're still working on keeping our really close links with Alex. Because we're really fortunate to have Alex in your area leading this work as well. As we've talked about already in this meeting, as an ICB and nationally, the focus on setting up neighbourhood teams this year is on people with frailty. And ICBs are asked to create the conditions for neighbourhood teams during this year rather than produce a particular plan and send it into the centre. So there are some key things we need to do to help create these conditions. And one we've talked about here before is back to the data and what system we're using to identify the patients on the GP's list who need this support for their frailty. In BLMK at the moment, we have the John Hopkins model because we've had Arden Gen as our provider helping us with that. And a lot of the practices have learned a lot from using that model of risk stratification. But as a central ICB, we are moving to a different tool, which is called Delphi and has been used in the Hertfordshire system. And that's been agreed now that will be rolled out across the whole of the Central East footprint starting sort of late summer. There's a demonstration going on at the moment for our practices. It is a really good tool, and in that tool you can see all the support residents are getting from different services, depending on what data sharing you've got in place. So we also need to update our data sharing agreements with our practices, and we'll be working on that as well. So that's one of these kind of enabling pieces of work that needs to happen this year to help our general practices move from that one risk strat tool to another, and all of us who kind of work in the background also having access to that data. So it's good that we've made a decision and that we're moving on with that. Also, in terms of the model of care, part of the ICB's job is to write a specification this year for neighbourhood teams to support people with frailty. And we have organised a conference across Central East on the 16th of July, to which colleagues are invited to come and either share best practice from their organisations and the evidence that they've got of the impact of their services, and to learn from others about what's out there. That will help us in two ways. One, as an ICB, to understand what the great work is that's out there and what are the best ingredients for the model we need to commission, but also it will help providers to come together and think about how they might work together in this new way, which is all of us work in this area now, providing support to people with frailty, but we don't work in a coordinated way. And by the time we get to April next year, we will want to commission a more coordinated approach to supporting people, and that's the specification that we'll be writing. So recommend colleagues to come along to that conference if you're able to, and please do show any of the good work you've done locally, which you've done lots, so others can learn from your good work. Other things that we've been working on, and Alex probably talk about this, is we need to agree our footprints for neighbourhoods this year. I think made good progress on that in Bedford Borough now. The profiles we talked about in relation to Vicky's report, there will be a neighbourhood profile for each area developed. It's kind of waiting, I think, for us to finalise the footprints, and then they'll be produced. And we also need to baseline things like what assets we've got in our neighbourhoods and what our workforce is in this area. So as I was saying, lots of us have staff who work to support people with frailty, whether that be in social care or in health or in the voluntary sector. And we need to get an understanding of what that workforce is so that we can bring that workforce together around those local communities. So they're the main priorities for us at the moment. And I think I will hand over to Alex now to talk about the Bedford Borough paper, if you like.
Yeah.
Yeah, was that okay?
Yeah.
Sure, is that item 12, actually?
Yeah.
Can we take any questions or comments on this one first? Sorry.
Yeah, sure. Sorry. Happy to take any questions there. And then Alex is kind of puts more flesh on the bones. for
Okay,
you.
well, thank you. Anybody questions? No? Sounds like we move on to Alex then anyway.
We're noting that report, yes.
Yeah, noting that report. Thank you, Maria. Carry on, Alex.
Yeah. So, report that I've done is kind of in two parts. The first part is about the neighbourhood working workshop that we had in April, and the second part is about the executive delivery group. So, if I just start with the workshop. So, there's about 30 colleagues came together at the end of April, and it was a really useful workshop. This one particularly was for our more senior leaders across health, social care. We had a number of BCSE colleagues there. We also had housing represented, fire and rescue, and others. So we tried to have a really broad group, and I think this is one of the earlier workshops of its kind in this for this patch. And we came together to focus on three key questions. And even though we talk about these things a lot, it was really important to get clear what's our common understanding of neighbourhood health and neighbourhood working? What do we want that to look like for Bedford Borough? And what do we need for it to be successful? Because it's quite a big concept, and then drilling down into the actual what is more tricky. So in that time, each table worked through different ideas and talked through different themes. And from that, we had some emerging priorities, which were similar across the different tables and groups having conversations. So those priorities were around establishing the neighbourhood leadership structures, including having named leads, strengthening the multidisciplinary team working and care coordination, improving shared data systems and records, mapping our local assets, as Maria's just mentioned, embedding resident voice and co-production, gathering neighbourhood level frailty data and identifying local priorities, bringing practitioners together to map what already exists, and defining success measures and evaluation approaches. So I think it's quite similar to the things we've been talking about, which is positive because it suggests that we're all on a similar or same page. So off the back of that workshop, I think some of the specific things that came out were that we talked about for each of our 4 neighbourhoods in Bedford Borough having clinical lead and a partnership lead. And the next phase is to create a sort of loose job description or a role, and actually talk to partners about who might take on those roles. And importantly, that we will also have support for the voluntary sector to do that. And we're looking at how that might be funded, because we know that that would need some payment. And the other part, one of the other parts was around our neighbourhood map that we've looked at on and off, and we started with 5 neighbourhoods. We've now drilled it down to 4, and we worked with our clinical directors, and they actually really led that and helped us map exactly where it would make sense to have our neighbourhoods based on the primary care networks. So those are being finalised, and then we'll be able to start having the data on those. Other things that we want to do, I guess, is then looking at the data and the neighbourhoods and who these key leadership roles will be, and actually start to move into more doing. There's already lots of things happening, but for example, I know that the hospital are keen to work with the primary care clinical leads around frailty and start to look at what that looks like. We need to make sure social care is involved in that as well. So there are lots of work streams emerging. And the next step is to obviously move forward with those. It's just navigating all of that in the sort of as we move forward, and also ensuring that we're aligning with the ICB where we can, so that we're not then asking clinicians or colleagues to duplicate across different places and do necessarily different ways of working. We need to.
And then the second part of the report is about the executive delivery group. So the highlights really from the last meeting, which was on the 11th of May, is that we're going to have a change. So Laura's stepping down as our chair, and Vicky will be taking up that post moving forward. And we're looking at streamlining that meeting to really focus in on the neighbourhood working. Now, we've been quite broad over the last couple of years, which I think has been important. But now we're looking at how we can have that as a really active group pushing that agenda forward. But in the meeting, we took the opportunity to sort of close several projects that had been running over the past couple of years. So one of those was the aged care technology project, which I believe I've reported on before. It was a challenging project. We tried to work with 4,000 residents, older residents, to run assessments of how they're getting on, and we found that the uptake was quite challenging. And the key learnings that we had through that project was that the people who actually did do the assessments really enjoyed having someone talking to them about what they would their challenges were, and although it's hard to say exactly, it does seem that seemed to help them spur them on to look at how they might get support for those challenges. But because we worked with a group of residents, or aimed to work with a group of residents that the aged care technology haven't looked at as much before, so those were from more diverse groups and lower income areas, we found that text messages through the GP wasn't actually the right way to go, and the real learning was that we do need to work much more strongly with our VCSE partners, and so that's something really important that we will take into our neighbourhood working. And then the other thing just to say is that we talked about the Working Together group, which has been running since August last year, and it's so this is a multidisciplinary team group that come together once a week to work with patients or residents who've been referred, who need specialist support. And there's lots of different things that they've sort of supported people with, but I think probably the key thing for here is whether that's a model that we might want to bring into our neighbourhood working and replicate in other neighbourhood areas. Finish that.
Thank you. That's really good questions for that.
To sort of you know, had in our conversation. So I guess, is the group going to change from executive delivery group? Is it more an operational group? I think that's the.
I don't think it was well.
I don't think it's quite an operational group.
No.
I think it's people who need to get on and sort out the doing, but they're not necessarily people who are going to do the doing, if that makes sense. So I think it's the place where we can have really lovely conversations about what needs to be different and who needs to work together to do things differently.
Okay.
But then there might need to be perhaps more kind of task and finish type groups that then might take forward bits and get more stuck into the operational detail underneath it. So I think it's still really important that we have senior people there who can bring their organisation's perspective, and while they might not be able to formally take decisions in that meeting, they can at least be well placed to then navigate that landscape themselves, if that makes sense.
Yeah, great. Yeah.
No more? Any comments?
My comment would be that the workshop you organised, Alex, was excellent, and there was really good participation and engagement from everybody who came, and it felt a real positive sense of momentum building. So we need to keep that going.
Yeah. Okay, then we have this report, and thank you very much. Item 13, Children's Health and Wellbeing Partnership Group. Ian, please.
Thank you, Chair. And just apologies in advance because I'm going to be doing 2 of these in a row, so bear with me. So this report, for those of you who haven't been to the meeting before, summarises the contributions that our partners have made over the last period since our last meeting to the objectives that we have in our current Children, Young People and Their Families plan. So there are 6 priorities within that, and I will just pick out from this quite long and comprehensive report some of the sort of key actions under each of the headings, if that's okay. So our first one is around children, young people feeling safe at home in the community. And our Youth Justice Service has highlighted good progress that's been made in terms of reducing reoffending rates. And we're currently running about 20 percentage points lower than our comparator authorities in terms of reoffending. In terms of our housing team, we've had a transformation in the way our housing team works in the council. And part of that has included creating some new specific roles, including roles around domestic abuse, early help and families, which are helping to make a difference on some of those genders as well. And that expansion of the housing team has also helped us to maintain 0 families in bed and breakfast accommodation for more than 6 weeks, as we've been able to increase the availability of suitable temporary accommodation. In terms of community safety, and I should have said at the start that this report is reflecting contributions from 4 services: youth justice, public health, housing, and community safety. And each time we rotate which of the services that we report on. So in terms of our community safety team, they noted the expansion in our antisocial behaviour team, who are now able to patrol a larger area and including parks, and that's creating a visible presence in our communities and increasing a perception of safety. Our second objective is around valuing and protecting the environment, and I wanted to pick up that again, our housing logistics team, they're working with households who are facing homelessness and at that point are trying to protect their possessions, and they're able to provide safe storage, but they're also able to help families to reuse, recycle and dispose of stuff where they don't need it anymore as well, so helping with our sustainability objectives. In terms of our third priority around providing a positive educational experience for all, our Youth Justice Service has been recognised nationally for work that they've done to raise the profile of speech and language needs in young people and children who are exposed to the criminal justice system. And that's included training of their staff, but also partner organisation staff, and also establishing a programme of communication passports for children, for example, when they're attending court hearings. So everybody who's involved knows how best to communicate effectively with those young people. And our housing team has been able to develop an in-house transport resource so that when a child is placed in temporary accommodation, what can sadly happen is that their attendance at school can be disrupted if they can no longer get to school because there isn't a public transport option for them, or they're no longer close to their school. So they may find that they have to move schools, or they may find they're not getting to school as often as they should be. So we now have an in-house resource that's able to ensure that those children and young people are able to get to school in those difficult circumstances. And this is therefore reducing disruption to their education. Under our fourth theme, which is strong and safe relationships, all of the staff in our housing service are trained to recognise and respond to people and families who may be experiencing domestic abuse. And at the moment, that team is working towards Domestic Abuse Housing Alliance accreditation as well. So we're trying to really embed that in the service. In terms of good physical and mental health, all of our schools, 26 of our schools in Bedford Borough have participated in the School Health Education Unit survey this year. We reintroduced this after a period of doing surveys at schools a different way. And each of those schools now have their individual reports. So that's information on over 2,500 pupils from years 4, 6, 8 and 10. And those reports are providing detailed information to schools about how those young people are feeling about their physical and mental well-being and their life experiences at that point. And as well as obviously schools now having that information to support their planning, we're now commencing a piece of work through our Children's Health and Wellbeing Partnership Group to analyse the themes that are emerging across the borough as well and develop our response as a partnership, because obviously the well-being of our children and people isn't just the responsibility of schools, it's not just the responsibility of parents and family members, it's all of our responsibility collectively. And then finally, just to note, we always make sure that listening and responding to the voice of the child is a key way that we work, and our services have highlighted in the report how they are doing that through consultation and through how that's already embedded in their practice. So I'll pause there on this report, but happy to try to answer any questions. Though bearing in mind this is the work of our partners, not my work, obviously.
Anybody with any questions? And then Ian, we'll note that and we'll move on to that one then.
Thank you. And this one will be a little bit shorter. So this is on behalf of Mark Harris, who can't be here today. So as well as our Children and Young People's group, we have a health and wellbeing strategy delivery group. So focused on how we are strengthening the foundations for health in Bedford. So thinking about those building blocks around employment, healthy homes, our built environment and stronger communities are 4 themes that we're working on there. In terms of employment skills and workplace health, in the last quarter, we have delivered training webinars to promote employee wellbeing and organisational capacity in local employers. And those have reached over 100 people employed by businesses in Bedford. And we've also initiated a workplace NHS health checks pilot at Bedford Hospital. And we are extending it now into the police and fire and rescue services as well. And that work is targeted it's targeted at those people in those settings who might not otherwise come forward for their health check when they're eligible. And we're thinking there particularly around our blue collar workforces, for example, in those settings. And we're working with the employers to encourage those colleagues to come forward for those checks. And where people aren't eligible for an NHS health check, we are providing them with a slightly more streamlined cardiovascular check instead. In terms of healthy homes, we now have smoking cessation officers who are funded through additional Green Fence grant funding for public health to provide additional capacity to our smoking workforce, because we know from Vicky's report earlier that we still have a sort of stubborn 1 in 10 adults who are smoking, and we need to put in additional resources if we want to bring that down. And one of the ways they're trying to do that is by embedding those roles in our local housing associations and developing new ways of working with them in order to reach housing association tenants who may wish to give up smoking, may be keen to take advantage of the financial benefits of doing that, helping to support their tenancies by holding on to more of their income. Also, I wanted to note that BPHA have created 2 new roles to support the access that tenants have who may be struggling with drug and alcohol or mental health issues. And those officers who are based again in the housing association will be able to support tenants into those local specialist services that we have, for example, drug and alcohol services that the council commissions, or indeed mental health services, the ICB commissions, and also the other resources that we have in our communities, like some of our voluntary sector organisations that work in those areas as well. And that approach, again, is obviously it's helping residents with their wellbeing. It's also hoping that will help them to sustain their tenancies as well and prevent homelessness. Under our built environment work stream, we are now completing health impact assessments on all residential developments over 50 dwellings in Bedford. And so that's those are completed by the developers, and then the public health team is reviewing those. And that's an opportunity to ensure that schemes are sort of delivering health benefits as well. So making sure, for example, that they have improved communal areas and green spaces that are helping to reduce social isolation and increase physical activity opportunities. Making sure that we've got good connectivity in terms of footpaths and cycleways, that we're linking to local public transport as well with those new developments, so that we're encouraging active travel, and we are making sure that people are connected to employment opportunities, schools, and social opportunities. And we're also, for example, making sure that building standards and the way the buildings are being configured on developments is improving energy efficiency, reducing risk of overheating and other things like that as well. So as well as that specific work that we're doing around HIAs, we are, I think we completed 3 HIAs, all for developments over 100 homes in the last quarter. We're also thinking about the new local plan as we're moving into a scoping phase for the new local plan. And as part of that, the public health team is going to be developing a health topic paper. So we will be putting forward policy options for consideration in ways in which we can use the local plan as a means to create a healthier place for everybody. And then finally, in terms of our strong communities work stream, there are sort of a couple of areas that we're focusing on there. We've got a volunteering group looking at how we can create and promote more opportunities for volunteering. There's an annual communications plan that's being developed, and I think that's kicked off really with celebrating Volunteers Week, which I think was last week. And we also have a series of weekly drop-ins at CVS, people who are interested in volunteering and would like to know more. We've confirmed funding for 26-27 for the Men Exercise, Engage and Talk programme, and I think we had somebody come and talk to us about that, a service user who's supporting other people there. So they're providing peer support for men who are 18 to 45 who, for example, have a long-term condition, mental ill health, or are feeling lonely and isolated. That's been a really positive story, that group, where that's worked. And we're also very close to launching a Safe Spaces scheme for retail businesses in the town centre, providing training and support for those businesses. So if residents who are in the town centre are feeling vulnerable or anxious or scared, then they will know that there are safe places for them to go to, where people will be able to welcome them and provide them with some low-level support and potentially onward referral if there are any sort of safeguarding or serious concerns. So we're starting that work as well. Now, I will stop there. Hopefully that gives you a flavour of the work that we're doing under the health and wellbeing strategies.
Any questions? I have one. Oh, good.
It's not a question, it's actually just, you may know this already, Ian, but the Central East ICB has been given additional funding to roll out the Work Well programme that's in CMP, so we should probably make sure we connect fully on that, because we don't want to. There's a certain model there, but it may need adjusting, but what we've already got in place to make the best use of the money.
Yes, I think there's a stewardship group that's that's looking at that, and I know that my colleague who leads on work health and public health is linked in with that as well. So we're looking at that. Got Connect to Work as well, which I didn't mention, but Work Well's coming, isn't it, very soon to our area, and it's already, I think, piloted in Cambridge and Peterborough.
Yes, I think it's the national exempt pass programme. So
we've got something to learn from that, as you say. All these things always require a bit of adjustment, don't they? Yeah. Thank you.
Last question.
I was just with your last point you made about safe spaces in town. Are you involved in the Bedford as an Inclusive Town meetings, Ian, or is somebody from?
Somebody is, yes. I think we're linking through with Tom Perritt with that.
Yeah, and I think Chris Morris is chairing it at the moment. So but that would fit perfectly with that. It would be good to get the information out via that group. And
I know, for example, our Parent Care Forum being involved in the Safe Spaces work as well as
fabulous.
So I think it's all linked up.
Brilliant. Thank you. Yeah.
What I was going to ask is, talking smoking in deprived areas, there seems to be an awful lot of illegal cigarettes going around. Is there anything we can do to try and to buy a pack of cigarettes is rather expensive these days, and I think it's the low cost of getting the cheaper cigarettes is the key to try and thwart some of the excessive smoking in some of these areas. They can't get hold of it at a sensible rate, will then buying very expensive ones.
Yes, and through our trading standards team, they do some really brilliant work in detective work, really, in identifying those shops that are selling illegal tobacco and confiscating that and then prosecuting them. So that's an ongoing programme of work. I don't know, Vicky, you've had more recent experience of being out in that with those teams. I don't know whether you've got any reflections on it.
Well, I guess just that you're absolutely right, and there's way more illegal tobacco around than I had really understood in my sheltered little life. But yeah, absolutely, it's a really important area, and we do link with our training standards teams around that work. And it's a really important aspect of our tobacco control work locally.
Yes, I know several people who disappear off and they come back with their cigarettes from wherever, and they pay a fraction of the cost of actual one.
Yeah, and those products may not have been, they may not have the right filters on them. There may be, other they may be a higher risk from a health perspective as well.
Yeah, thank you for that. Have we any more questions?
Just a quick one. Again, you know, I can see there's a lot of changes of behavior, especially with the young people. You know, when you ask them, do you smoke? No, I vape. So they feel that vaping is okay. But I just wanted some kind of sort of a social media or some kind of a strong information out there for public. You know, whether we can use that in the waiting rooms or in our website, just to sort of say that we don't have any evidence to say that vaping is good or bad, but we know that it's not good, and it's just that there's so much information out there for smoking, which is brilliant. I think we do need something for vaping as well, and most of them they would have said no, and we say not a smoker, but then if you dig deeper, unless you ask questions, they won't accept that they are vaping unless you ask them that question. So I think there is some kind of a myth there thinking that vaping is okay, but I don't smoke. So anything, you know, from NHS England or from public health would be helpful.
So I think there's a few things there. So I think so we've already produced some resources around vaping on our Choose You website, which is our integrated behaviour change website, which includes smoking cessation support. We don't currently support people to stop vaping. In fact, we recognise that as a harm reduction approach, that vaping, whilst it's not harm free, it's a lot safer than smoking. So we offer vapes as part of our stop smoking offer. So that for some people, if you're already a smoker, then we, you know, and people are not interested in other forms of nicotine replacement therapy, then we will support them to vape, and we will do that in a way that is controlled, and we will encourage them to reduce the amount of nicotine that they're vaping over time as well. But what we would say is that if you are not a smoker, then you should not start vaping and, you know, become addicted to nicotine. So we're very clear about that. So I think what would be good is to think about linking you in with our Choose You team and the resources that we've got, sort of tobacco control resources that we have, see what messages we can put out there. Because I think it is a nuanced message, because we do want to encourage smokers to swap if there's no other choice that works for them. But we're very clear that we do not want anybody who's not a smoker to start vaping, and we're particularly concerned around children and people in that space as well, make sure it doesn't become a gateway to nicotine addiction.
It's particularly a challenge in adults taking up vaping, thinking that that's okay. That really helpful.
Peer pressure, isn't it, from youngsters and peer pressure and vapes, I think. Oh, yeah.
Ian, I just noted in there about the volunteering, and just say that we are always looking for volunteers within our family hubs. We have a strong volunteer community there. We want to build it, so anything that we can do to connect in with that, I think would be appreciated. So just to note that.
Well, I would point you towards Mr. Trinder.
Make sure that we've got the right details to make sure they're connected.
Excellent. Thank you very much. Perfect.
Kate has a comment.
Oh, it's probably past now. It's just referring back to the safe spaces, making sure all those connected groups are all involved. But I think because of the gap with Mark being off, it's just I can check outside of this meeting. It's just a comment, because there's been a long-standing 10-year programme in the community for people with learning disabilities, just that connection.
And so, for example, people like Biz Heseltine sit on that group and challenge us very frequently to make sure this is accessible and suitable for people with learning disabilities.
Yes, and also the review of the existing safe spaces, because times have changed.
Yes,
it's part of that, isn't it?
Yeah.
So that's great. Thank you.
Do you have any more comments? Questions? No? In that case, we'll move on. We know that, sorry. Note that bit. Health and Wellbeing Work Programme, I think is next. If you have any suggestions for the Health and Wellbeing Work Programme, please let Ian know. Okay. There you go. Then is the next one, and so we move on to the next meeting. Is it a workshop or is it a
September's a formal meeting.
Yeah, it's full meeting. Okay. Thank you. So the next meeting is on the 23rd of September at 12:30. Thank you, everybody.
Thank
Thank
you.
you.
Thank you.